The Water Sanitation Association of Zambia was supported with a grant in the initial cycle 1. They got funds to implement their biodigesters, biolatrines, in 2 community schools.
Our main focus was to not only improve the sanitation facilities in order for the students to be accessing them, so that we can also improve attendance in the classrooms. Our other focus was to also protect underground water through the implementation of the biogas digester, because they're watertight, and through the use of the toilets, no fecal matter is able to contaminate underground water.
The old toilets was built by changes too. Then the Wasaza came in. They said we want to add more toilets. The pupils, upon seeing that they've built these fresh toilets, then the pupils were very happy, because before it has no privacy.
We are setting up sanitation facilities that comprise of a biodigester and then a superstructure comprising of the toilets. We have an average of around 800 pupils per school times 8. That's around 6,400 pupils.
In the second cycle, Wasaza was given a grant which supported 8 additional schools with a similar project, with a similar interventions of doing biolatrines, but also providing water to the schools which didn't have.
Our sanitary facilities were not enough, because we only had 2 toilets for boys and also 2 for girls. And we have 560 pupils sharing those 2 toilets. This has added value, because we have 3 more toilets added to the 2, bringing it to 5 for boys, 5 for girls. And also an extra toilet for male staff, extra toilet for female staff. We also have an added advantage of having a shower for boys and girls. You know, sometimes our children come to school without bathing. So with the shower in place, it's adding value.
The total beneficiaries amount to about 8,700 in total. For the students, it was very important for us to upscale, because we also had to look at the aspect of menstrual hygiene, especially for the female students. So this second phase incorporated the aspect of health education in menstrual hygiene management for the female students, as well as for the female teachers that were able to facilitate to deliver these talks.
Some children used to get diarrhea, so the enrollment of the school, other children used to get sick and their parents used to come here and complain. Because of that, the school was turning down, so they had to close it for a few months. Hygiene is important, because when you maintain proper hygiene, you can keep away from germs.
It is a very big shift, because at the moment at least we have eliminated the issues of queuing up and all the toilets being occupied while other students might want to use them. And the incorporation of the education aspect that we brought in as well, teaching the students as well as the teachers proper ways of handling the facilities and the damages of maybe urinating outside or defecating openly. We were able to use something that we did through the education and health sessions that we are doing with each and every school with the students. So that more or less added to the knowledge base on issues of sanitation and hygiene, and why they're supposed to be doing certain practices the way they're supposed to be followed in order to prevent outbreaks of diseases.
Ever since Wasaza came in, we are privileged to have been given a chance of them bringing a new toilet, and this is going to provide the school with good enrollment, because one of the needs of our parents in this community is they want to see a good school where they take their children to. When we look at the toilets that you've brought now, they are good, and they are not only good, but they are also going to provide good hygiene to us as a school and the learners.
We started our operations in 1999, and most of the activities that we do are community-based. We've been working with schools across the country. We've done quite a number of projects. In implementing the project, as Wasaza, we had to undergo a lot of capacity building in certain departments, notably the financial department, procurement. We had to learn new ways on how to procure best. So that's definitely information that is going to remain with Wasaza, and those are the changes, the positive changes that the grant has actually brought to the organization. And we have also been able to collaborate with different stakeholders. Before then, we only had worked with maybe a couple, but with the coming of the grant, we were able to meet new organizations such as Afya Mzuri, Keepers Zambia, that at the moment we've been able to collaborate with to work on certain aspects of project management, or it can be implementation in construction of toilets or menstrual hygiene management. So the grant definitely brought a lot of changes to Wasaza.